Well, good evening, everyone. I'm Dennis Stone, Director of the Center for Advocacy and Social Justice at the Jacksonville Urban League, and we're so very pleased to have with us tonight an expert in the area of maternal health and newborns. And we know that it has been a severe problem for decades that only recently has been focused on by the medical profession. And I'm going to turn over our uh, the mastering of ceremonies to Dr. Waleed Zahoor, who has helped bring our speaker on board and is an expert in epidemiology. So take it away, Doctor.
Hello, everyone. Welcome to our public town hall on maternal health, and uh, and we have with us Dr. Chinyere Reid. I would like to introduce all of you to Dr. Chinyere Reid. Dr. Reid is a public health researcher and maternal and child health expert affiliated with University of Florida. Her work focuses on improving maternal and infant health outcomes with particular attention to health equity, perinatal care, and behavioral health. She has contributed to initiatives that strengthen public health data systems, including efforts to improve birth certificate accuracy and mental health surveillance in Florida. Dr. Reid is committed to community engaged approaches that addresses disparities in care and access. Her work integrates research, policy, and practice to advance outcomes for underserved populations. Everyone, please welcome Dr. Chinyere.
Thank you. And let me just share my screen. All right, so good evening and thank you for being here. My name is Dr. Chinyere Reid, and I am a postdoctoral associate at the College of Medicine, Jacksonville, at the University of Florida. And over the past 10 years, I have worked with pregnant and postpartum women in a research capacity, and I've been focusing on barriers to high quality maternity care, particularly for women from underserved and underrepresented communities. So, tonight we're going to discuss mental health during and after having a baby. And this is a topic that affects many families, yet it's often not talked about openly. So, tonight, our goal is to help you understand what these mental health challenges look like, how to recognize warning signs, and practical ways to support yourself or someone else. So, whether you're pregnant, whether you're a parent, planning to become one, or someone who works with families, this information is important. So I want you to take a moment to reflect. Have you or someone you know experienced significant stress or sadness around pregnancy or early parenthood? And keep that in mind as we go through the presentation. So, about 1 in 5 mothers experience mental health challenges during pregnancy or within the first year after birth. And even more so, you have 1 in 3 women of color who will be affected. So that means almost every community, there are families affected by this, right? So these mental health challenges, they are a leading cause of health complications for mothers, and they can also affect babies and families. So it's important to remember that experiencing these challenges is not a sign of weakness or failure, because it's a common medical condition. Known early recognition and support can improve the outcomes for mothers, children, and families. And for stakeholders here today, this emphasizes why community level support systems are essential to prevent long term health disparities. Now, when does this happen? When do they have mental health issues? So, mental health challenges can occur during pregnancy, right after birth, or actually anytime within the first year after giving birth. And pregnancy and early parenthood are times of significant change, whether it's physically, emotionally, and in daily routines, right? So changes can occur there. And hormonal shifts, sleep disruption, and new responsibilities, these all contribute to vulnerability. So even if someone seems prepared on paper, these changes can still be overwhelming, as you can imagine, right? So think of it as a perfect storm. You know, a woman has high stress, she has low sleep, and life-changing responsibilities, and these are all happening at once. Now, in terms of common mental health challenges, the two most common conditions are anxiety and depression, and you might have heard of either. Now, anxiety can appear as, you can have constant worry, tension, or fear about things that may never actually happen. While depression may show up as sadness, loss of interest, or feeling disconnected. And there are some rare conditions like postpartum psychosis, which can develop quickly, and that requires urgent care. So even though these challenges can feel isolating, they are common and they're treatable. And importantly, knowing what to look for helps families and communities respond effectively. Now let's talk about anxiety during pregnancy. So pregnancy anxiety can feel like a worry that you can never turn off, right? So you're just always worried. And someone may replay worst case scenarios in their head repeatedly, or they might feel tense and restless for no clear reason, right? And the physical symptoms like rapid heartbeat, nausea, or difficulty sleeping can occur. So, take for example, a mother might spend hours thinking about complications that are unlikely or worrying about whether she's doing everything right or correctly, right? And acknowledging this anxiety and seeking support early can prevent it from becoming more severe and help mothers enjoy pregnancy more fully. So, depression after birth, this is often called postpartum depression. Now, this can feel like persistent sadness, lack of energy, or a loss of interest in activities that you usually would enjoy. And it may also affect the bonding with the baby, and it might make daily tasks feel quite overwhelming. So, a real life example is think of a mother who expected to feel happy after giving birth, right? Because that's how women are expected to feel after giving birth. But instead, she feels constant exhaustion, sadness, or even guilt. She may worry that she's failing as a parent, even though this is a medical condition and it's actually not a personal failure. So, depression can appear gradually or suddenly, and it can be mild, moderate, or severe. But recognizing it early and getting support can dramatically improve outcomes for both mother and baby. Now, it's important to talk about something called the baby blues because many people experience this and may not know the difference between baby blues and postpartum depression because they are different. Now, the baby blues are very common. It affects up to 70 to 80% of mothers, and they usually begin a few days after giving birth, and someone may feel emotional, they might cry more easily, they might feel overwhelmed, or even have mood swings. And these feelings are largely due to hormonal changes, lack of sleep, and the adjustment to a new routine. And the key to remember is that the baby blues are temporary, right? So they typically improve on their own within about 1 to 2 weeks. Now, postpartum depression, on the other hand, is different. These symptoms are more intense, they last longer, and they interfere with daily life. So instead of the occasional sadness, it may feel like persistent sadness, like you're always sad, have low energy, or even difficulty bonding with the baby. And one of the most important distinctions is the duration and the severity. So if symptoms are lasting longer than 2 weeks, if they are getting worse instead of better, or if they make it hard to care for yourself or baby, that's when we start to think about postpartum depression rather than the baby blues. So, a helpful way to think about this is baby blues are common, they're mild, and they're short term, and postpartum depression is more serious and requires support. So, if there's ever uncertainty, it's always better to check in with your healthcare provider and know that early support can make a big difference. Now, when is it urgent? While most cases of postpartum depression or anxiety are manageable with support, some situations are urgent. So these warning signs include if the person is feeling out of touch with reality, if they're seeing or hearing things that aren't there, or if they're having thoughts of harming themselves or the baby. These are medical emergencies, and getting help immediately is critical. So you'll need to call emergency services or go to the nearest hospital or reach out to a crisis hotline. It's very important that for family, friends, and community members to know what these red flags are, as quick action can be life-saving. Now, in terms of warning signs to watch for, right? These are the warning signs that are common, and these when someone may need help, right? Letting you know when someone may need help. So, if the mom has been feeling this way for more than 2 weeks, right? If maybe she avoids friends or family, not eating or sleeping well, and struggling to care for baby or herself, right? So imagine a friend who just had a baby. She's exhausted, she stops answering calls, and says she feels overwhelmed all the time. Now, recognizing these signs early can help you provide support or encourage the person to reach out for professional care. And as a brief exercise, I want you to just think about your community, right? Who might be at risk, and how would you help them notice these warning signs? Right? So, do you know of whether it's a family member, a neighbor, or friend, someone in your community who's probably pregnant now or recently had a baby, right? They might be at risk, right? And how could you help them notice what the warning signs are? All right, so think about that. So, I want us to take a poll. Let's take a quick poll. So I want to know before today, how much did you know about postpartum depression? Was it A lot? Was it B, a little? Or was it C, not much? Okay, so I have some a lot answers, and then I have some who say a little. Okay, great. So hopefully by the end of this presentation, those who knew a little or not much will know some more. Now, let's talk about who may need extra support, right? So, there are some factors that increase risk for mental health issues during pregnancy or postpartum, right? So, these include if the person has had previous mental health issues before, if they have a little support at home, maybe they're dealing with financial stress, right? Or maybe they've had a difficult pregnancy or birth. So it's important to understand that these factors increase vulnerability, but they don't cause the mental health conditions by themselves. And communities can address these risk factors by providing support programs, affordable care, and social interaction and connection for these mothers that are affected. Now, what are some of the barriers to getting help? Because even when someone wants help, barriers can make it hard. And these barriers can include the cost or the lack of insurance, right? They might be experiencing transportation difficulties, or they might have difficulties in finding the right types of providers to help them. And then another barrier that, sometimes we forget about is stigma, right? And this is the fear of judgment or shame. And this also prevents people from seeking help, right? In the Black community, sometimes, when we talk about depression, they'll be like, oh, you're not depressed. Oh, so that kind of stigma prevents people sometimes from getting the help that they need or talking to someone. And this is where community systems and stakeholders play a crucial role in creating accessible, culturally sensitive, and stigma-free pathways to care. Now let's talk a little bit about stigma and silence, because many mothers, they feel pressure to manage it on their own, their health crisis on their own. They may say, I should be able to handle this, or, they feel guilty asking for help. And silence can prevent early support and it can worsen outcomes. So talking openly about mental health normalizes it and it encourages others to seek help. And community awareness campaigns and peer support groups are effective ways that we can combat stigma when it comes to mental health. Now, why does this matter for babies? Right? Because mental health affects more than just the mother. It influences the parent-child bond, early development, and overall family well-being. So, supporting mothers improves outcomes for children, which include better emotional, cognitive, and social development. It also strengthens family resilience. So, when communities support maternal mental health, everyone benefits from this. So now I just want us to take a pause here and watch a video where Shawnette tells her story. It's about a 4-minute video, so it's a pretty short video.
Alone isn't the only way forward with postpartum depression, even when the odds feel stacked against you.
My name is Shawnette. I'm from Manhattan, New York. My postpartum depression was something that I didn't really know much about or have had any experience working around. I was looking to conceive after getting married in 2019, but it was like I was getting a lot of roadblocks. So after going to the doctor and them verifying that 6 weeks pregnant, the baby's in the uterus and everything is fine, I couldn't find the joy because I was more so shocked and just miserable and just unprepared for the reality that I was about to face. Because I'm in a long distance relationship, my partner is not physically in the United States with me. I'm physically doing everything by myself on top of working more than what I'm supposed to keep a roof over my head. So there was a lot of loneliness. There was a lot of just uncertainty. When I went home, it was just me, my two oldest, and then the baby. I couldn't really do much with her because with the C-section, I was in pain. So my two oldest helped me as much as they can, but it was just a detachment. Like, she'll look at me and I would just look at her with regret. Like, I don't know if you should really be here. Maybe I should have thought twice. This is not something I'm ready for. If I was to do anything to myself, would they be okay? My mind was just like shriveled up inside. It was like, I gotta start all the way over now with a baby. I'm doing this by myself. I couldn't really bond with her because I was dying to either get outside or to get the help or to find out why am I feeling like this. So when I went for the baby's checkup, they had me fill out the survey. When they said, do you feel like you want to harm yourself? I said yes. And they counselor has stepped in and tried to give me some resources which were not helpful because of COVID. I couldn't go in person. And the virtual ones were so backed up by months that if I wouldn't have had the employment assistance, I don't think I would be here today. I had to call my manager and let them know, like, this is what I'm going through. Is there anything that you can do for me? I understand I can't physically come back to work, but I need the help. So they had connected me to Resources for Living. I was told to download an app, and like every other day, the same person consistently checked in with me and just pretty much helped me on a day-to-day basis. The counselor and the therapist actually was not even only there for me, but they were there for the children as well, because with them even helping me change diaper, make bottles, it's like, do y'all want to talk about anything? Is there anything bothering y'all? So it helped the relationship with the children, and it helped me personally to know, like, this person came into our lives and they still continue to interact with us to just make sure if anything is getting blurry, we're here. The more that I interact with people and get an understanding of what they went through, it kind of helped me know that I might have went through the worst, but the days are getting better. But I just have to take it one step at a time instead of trying to overwhelm myself with more than what I can handle. When you're a parent, you forget about yourself because you want to make your kids happy, your partner happy, but you just don't worry about your own self, which is what I find myself doing all the time. So I think I have to really figure out who I am and figure out what makes me happy. But I don't think I'm ever going to stop fighting for a better day. Every day I wake up looking to learn something that can help me continue my journey, because I'm not a person that know everything, and I'm always willing to learn. That's my goal.
Talking can lead to healing. Call or text the National Maternal.
Okay, so we just watched a video with Shawnette telling her story about how she suffered from depression during pregnancy and also after giving birth, and how she sought help and got connected with care and support and took things one step at a time. So, what can mothers do when experiencing mental health challenges, whether it's during or after pregnancy? Mothers can take several steps, just like Shawnette did. And this includes talking to a trusted person, resting and accepting help, reaching out to a healthcare provider if symptoms persist. So even small steps make a difference. For example, sharing feelings with a partner, a friend, a counselor, this can reduce stress and prevent symptoms from worsening. Now, how can others help? Family, friends, and neighbors, they all play a key role in this. Listening without judgment, offering practical help like meals or childcare, and staying in touch are very helpful. Sometimes the simplest act of just checking in can make someone feel supported and less isolated. And then community support does matter, right? That's very important. Communities can provide structured support through support groups. There's home visiting programs, there are accessible mental health services, and through community education. And for stakeholders, investing in these systems reduces disparities and improves outcomes at the population level. So here are some key resources regarding maternal mental health. So whether you're pregnant, whether you're postpartum, or whether you know someone who might be affected, there's the Postpartum Support International, and you can see the website there, postpartum.net. There's the Maternal Mental Health Hotline, 1-833-TLC-MAMA. And then you do have the Suicide and Crisis Lifeline, where you can call 988. And then we also have the United Way for Northeast Florida, where you can dial 211. And they connect people to human and social services for mental health support. And when we look at more local community resources, we have the Northeastern Florida Healthy Start Coalition. So Healthy Start, through their Magnolia Project and the Hey Mama mobile pantry, they offer care coordination and mental health support and services for coordination and mental for services for pregnant women and new mothers, sorry. And then you do have the University of Florida Health Perinatal Mood Disorder Program, and they aim to bring support and resources to new mothers as early as possible. So from evaluation to treatment plans to counseling. And then we have the motherhood space, which is offered by Baptist Health. This offers a specialized day program for women with postpartum depression and anxiety disorders at the Baptist Wellness Center, along with educational videos and virtual support groups. There's the Better Beginning Wellness Center. They provide expert counseling therapists for postpartum depression, anxiety, infertility, and pregnancy loss. And then we have both the Florida's Maternal Behavioral Health and Social Services Resource Directory and the Florida chapter of the Postpartum Support International that I mentioned earlier. These both connect moms to a trained provider in their area, and they offer online support groups. So, I will encourage you to make a note of these places and Google them and find information because they have lots of resources and their contact information there. So encourage anyone struggling to use these resources as they might find them helpful. So let's reflect on this situation with our final poll. Now, if a friend was struggling, what would you do? Would you A, listen and support, B, suggest professional help, C, you're not sure, or D, seek urgent help? And you can drop that in the chat. And this helps us to think about how we would respond in real life and how we can support others. So let's see. So I'm seeing A's, and I see a B, some more A's. Give it a few more seconds. Okay, so for the most part, we have all A's and one B, and that's fine. So yes, definitely we want to listen and support that new mom, right? But B is also correct because we might need to suggest professional help for her, right? And then if you chose C, no one chose C, but if you're not sure yet, that's okay too, because hopefully after you go through this presentation, you'll be able to know how you can ways in which you can support someone who's affected. And then D, seek urgent help, right? So in some situations, you might need to seek urgent help, like we talked about, if they're hearing voices or seeing things that no one else does, or if they might be a harm to themselves or their baby, that's when you need to seek urgent help. All right, so great. So overall, to summarize, mental health challenges during and after pregnancy, they are common, and you are not alone. Help is available, and support does make a real difference. So remember, early recognition and support benefit mothers, babies, and the whole family. And these are the references that support the information presented today. And I want to thank you for your time and attention. And I encourage you to take what you've learned and share it with your friends, family, and others in the community. And I'm happy to take any questions.
I have a question.
Sure.
Do you think this antenatal or postpartum depression or blues uh, could they be added into the services provided through when the mothers are getting their antenatal and perinatal health through their physician?
Thank you for that question. So absolutely. First of all, we want to screen moms, right? So For women, usually they get a screening or a depression screening while they're pregnant. And the issue is sometimes this is different across different um, prenatal settings, right? So some women might get screened once during pregnancy and maybe again postpartum. Some women might not be screened during pregnancy. They might only be screened postpartum. So I think the first important thing is having women be screened during pregnancy, right? Because you can have mental issues during pregnancy and then also after pregnancy. I think they're trying to standardize where they get screened twice during pregnancy. So early pregnancy and in the third trimester, and then again postpartum. And sometimes, usually they might be screened in the early postpartum period. But then again, remember, these women are at risk for mental health issues up to a year, right? So postpartum depression can happen up to a year after you give birth. So yes, even if you're screened in the early when you give birth, but what happens for that whole year? You're still at risk of developing postpartum depression. And if no one's checking for it, it might be missed, right? So definitely, I think the first thing to do is screen. And for those who are at high risk, right, or who screen positive for, whether it's depression, whether it's anxiety, then refer them to the needed support that they might need. And sometimes this might just be a support group. Sometimes, they might need to see a healthcare provider, whether they need to go on medication or not. And sometimes it's just addressing whatever social needs that they have, which might be contributing to the stress that they're experiencing and the mental health issue. So I hope that answers your question.
Well, Dr. Reid, I wanted to thank you. It was incredibly helpful and very practical. And just to sort of emphasize a couple of things you said, and maybe to put a finer point on it, for women and families that don't have a medical background, what are some of the most important warning signs during pregnancy or postpartum that should not be ignored?
Right. So, let's go back to, we talk about, because a lot of focus has been on mental health in the postpartum setting. But like I said again, women are at risk during pregnancy. Now, if you do have a family history, that increases your risk, right? But for the most part, most women will not have a family history, right? But again, it's her not being herself, her worrying, which is beyond normal, right? So the duration and the severity of the symptoms, worrying about a pregnancy when there's no need to worry about it, right? Being sad constantly for no reason, right? Or maybe feeling like harming herself or her baby, right? Those are important things. Or maybe hearing voices or seeing things that no one else around sees, like it's not real, right? No, that's when you really need to be concerned, and that's considered urgent. That's when you should support them, listen to them, but also help them get professional care with a healthcare provider, or call the crisis hotline to get more direction for that. And then again, in the postpartum period, you also want to think of differentiating the baby blues, which is very common, right? Most new mothers are going to experience that. But again, you think about it differently from postpartum depression because of the duration and the severity, right? So, when you think of baby blues, it's only going to last a week or two. Within that, they cry, they might feel emotional, but after a week or two, that disappears and they're back to themselves. But then if it's this constant, persistent state of sadness, they don't enjoy doing things that they feel like doing, they might not be connected or have an attachment to their baby, right? These are things, and this usually goes on for more than 2 weeks. It's persistent. That too are signs that you should be concerned.
Thank you. And and I know you talked about the steps and you gave us our poll, but there's a stigma uh, involved with mental health.
Mhm.
And many women hesitate to talk about it. What are some ways that we can help reduce the stigma uh, in families and communities?
And I think you mentioned it, is to talk about it, right?
Yeah,
The
right.
way to get around stigma is to talk about it, right? And we already have stigma just in the general population when you think of mental health, right? And in general, people always think pregnancy is this happy, you should be joyous, and you're expecting a baby, and when you have your baby, you're connected and mwah, mwah, mwah. But then in reality, that's not always the case, right? So that needs to be normalized. And more importantly, you as a mom being affected need to realize that this is not your fault. This is not a personal failure of yours. It's a condition, and this condition can be treated, and you can come on the other side. So I think most importantly is having the discussion, start talking about it, normalizes it. And for others, the support system, having a support system, a doctor who listens, family members, spouse, community who listens, and you too, as the individual, sometimes recognizing and not being afraid to ask for help. Because I think once people feel supported and not judged and people listening, then they're more likely to open up themselves to seek help and receive help when it's offered. So I would say the most thing is just to keep talking about it. That normalizes it, and it's not a failure on your part as a new mom.
Thank you. Thank you very much. I have a few others, but I'm going to hold off because I'm sure there are others that have questions.
I would like to add something that uh, the town halls like these are, I think, a great opportunity that provides information and education about the mental health during pregnancy that people may not be aware of. So I
Mhm.
think as many town halls and educational content that can be circulated to the mothers that would help uh, in uh, I would say spread information about all of this so that more people would be not shy to talk more about it.
Yeah, absolutely. I'm in full agreement of that. And, it's great that, when you're doing these town halls, you're not just um, doing a presentation to those who it affects, like the individual, but you're also doing it to their support system, right? Where their support system can learn more about it. And, for example, in this presentation, learn what the signs are. So maybe the woman who is pregnant or postpartum might not see this video, but her partner might, her mom might, her brother might. And then he learns the symptoms and be like, oh, wait, I noticed my sister or my wife, you know, checklist, checklist, checklist. Okay, it's time for me to go. I know what to do. It's time for me to go support it, or it's time for me to go connect her to a healthcare provider, or it's time for me to call the hotline or reach out to these community services. So definitely in addressing stigma and in educating the community, these town halls and platforms like this are very helpful in getting the word out there and also normalizing these issues.
Thank you, Dr. Reid, for taking the opportunity to speak with our audience once again. And this question isn't for you, but more so for our audience, because I do know that we do have some mothers here. And I want to ask, do you all feel supported? Is there anything that you need? Is there anything that we can do to bring more resources to you all? I know that we shared, or Dr. Reid shared, and then I put it back into the chat, some of those resources available for postpartum care and depression and things of that sort. But is there anything else that we can do, and do you all feel supported at this time?
I had something to add. I am a mom, and I have two kids under two. And I think that something that is important. So, for instance, my husband, he's a nurse. He's very supportive. He's very observant in things that I need. He knows me very well, and so He knows when I'm having an off day, especially like I went through postpartum really bad with my first child. But I think that something that's really important is even for people who do have support, like this is a really great and informative thing. But I think getting more of the pregnant or postpartum woman's support system involved in something like this would be so important because especially for me in my experience, I have so many days where like the mom brain, that brain fog kind of sets in. And it's like, obviously I know like the signs and symptoms of postpartum depression are like different off things, baby blues, stuff like that. But when you're in the thick of it, I think, and that fog sets in so intently, I think it's important for your support system to really kind of be drilled in the signs and symptoms of it so they can kind of bring you back and like help you realize that a little bit quicker because if you don't have that, you could be a couple weeks in and just forget. Like there's so many things you forget, like to eat or drink or shower some days. And it's like you just kind of need those gentle reminders of like, hey, maybe it is time that we go get a little bit help. I've noticed that you haven't been eating or, talking to me as much or answering the phone as much or a little bit distant. So like having your support system drilled and having these resources for them too, I think is very important as a support for that mother.
Absolutely. I totally agree with that because for the most part, most times it might not even be the mom who is like, ding, ding, I have postpartum depression. That's usually not how it goes. It's usually other people close to them notice they're just not the same. Like they're acting different. They're withdrawn. They're not attached to the baby. So you're absolutely right. Those are the people who are likely to spot it and the signs because when you're in the thick of it, that's the last thing you might know like, okay, these are the signs, but when you're in the thick of it, that's the last thing you're thinking of in connecting those dots and saying, yeah, I'm depressed, right? And then knowing that there's someone who, because again, too, there might be that self-blame, that guilt, right? It's my fault. But having that someone external who can say, hey, I notice XYZ, you might need some help and I'm here to support you. That will also, encourage the person to want to seek help and to accept help when given. So definitely it's important to have the support systems who become knowledgeable in the signs to look out for because they're the ones who are more likely going to notice it than the individual who's going through it.
So we have a comment from Chinyere, who says, same here. I am a mother of two boys, two under two. I have an amazing support system, heart. Even with their support, it gets hard. I must say, every day is different. Some days where I don't feel like myself. Therapy has been my biggest help. And thank you, Chinyere. It's so important that you share that fact, and it helps break that stigma, as Dr. Reid was saying.
And Kamira, thank you for sharing. And it's not an easy journey. Even when you do get help, it's not gonna make a 180 overnight, right? But you will, I want to encourage you and other women who might experience this is that, you will get on the other side. Just take it one step at a time and you will get on the other side.
It's interesting, two of the most powerful um, programs I've heard on this topic. One was related more to pregnancy and the lack of attention that women get during their pregnancy and during their delivery. and there was a program on NPR about this woman who she was a nurse at a fairly high level, and she had need of a cesarean all of a sudden, and and she was surrounded by experts,
Mhm.
and they didn't, and they wouldn't listen to her when she said, "I'm feeling pain," after they gave her, whatever anesthesia that they normally give. And it was just, and so then they followed up. They had a conference on this, and all of these doctors, mostly male, admitted, yes, we've had this problem, and sort of opened the door.
Mhm.
The other one, more related to this, was I sent the link in the chat, was a recent program on First Coast Connect, our local program that brings in speakers every morning and on NPR. And this was a physician who started, it got so bad she was hearing voices. And she's the one that started Mother's Space at Baptist because
Mm.
she realized this is a huge problem. Because she went from everything's fine to suddenly down, went from blues to, like you were saying, very powerful. And I mean, in some ways, you'd say luckily it happened to her because she understood it for what it was and could um, uh, create the mother space through
Mhm.
her professional connections. So anyway, I just thought I'd share
And
that.
that's wonderful because sometimes a lot of these support groups are fueled by people who have had the lived experience,
Right.
right?
Yeah.
And, I also just wanted to talk about the support groups. So, there are what's called peer support groups where, you know, you're not supposed to feel alone, right? Because you're not the only one going through it, right? There are a lot of other women who go through it. And a lot of times in these support groups, they're women just like you, right? So, just know that it's not necessarily just you and the therapist, but then you have other women who are experiencing the same thing you're experiencing to some degree, right? Where you guys have common ground so you don't feel like you're alone, right? So I just wanted to share that.
Other questions for Dr. Reid?
What fueled your passion for specializing in pre and postpartum depression?
Well, thank you for that question. Would you believe it? It was COVID. Right. So actually, it all started when in my earlier days, because I am a physician too, but I don't practice. Psychiatry, when I rotated through psychiatry, I was always interested in mental health. It was such an interesting thing to me. And I said, you know what, if I ever move on with this, I might specialize in psychiatry. But then I went into research. So at that time, I was doing my PhD and I was looking for a topic. And it first started out, I was looking at the mental health of students, right, during the COVID-19 pandemic. But then my work is in the perinatal population. So I already look at pregnant and postpartum women, but I look at the research I was doing at the time is more their access to care. And then everyone was, having mental health issues. Like we can all relate during COVID, whether you're pregnant, whether you're not, whether you had a job, whether you didn't, we were all going through it. And I was like, I can't imagine what pregnant women at this time, because here we are as regular people, we're worrying about catching COVID and what it could do to us. Can you imagine you have life within you and you're not just worried about yourself, you're more worried about your baby. And at that time, there were no vaccines. And then even when the vaccine came out, you now have another worry.
Mhm.
Is this vaccine safe for my baby? Right. So I could not imagine the stress that women were going through, right? And again, typically people tend to think pregnancies is happy, time, right? And then it's not that way for everyone. And then add on it this burden of this worldwide pandemic. You're not only worrying about yourself, you might have other kids, younger kids. You don't want to expose yourself, get your baby sick. There's so much unknown with this. And I was like, you know what? I would love to see what women are going through because a lot of times there was this rush. It was in the beginning of COVID. And I actually my dissertation study for my PhD, I actually looked at the influence of stress, the COVID-19 pandemic stress on anxiety and depression in pregnant women. And I also looked at maternal fetal attachment during the COVID-19 pandemic. So that's basically the attachment or the bond a mom has with her unborn baby. And I found that women were greatly affected. And my study was in Florida too. So Florida pregnant Floridians were affected by the COVID-19 pandemic, and that just fueled my mental health interest in the population of pregnant women and postpartum women. And now I also, that moved me on to even look at mental health in women with substance use disorder, because that's an area too that I do research in. So like I said, I like to my passion is serving underrepresented and underserved communities. And a lot of times, I think in the mental health space, um, the US is not as advanced when it comes to perinatal mental health as other nations, as like Europe and the UK. They are really, when you talk about perinatal mental health, they're really like forward thinking and advanced when it comes to this. So that's really, what drove me. And my passion is to see um, an improvement and better access to care, normalizing and reducing stigma, and also helping populations where, especially for people of the minority population. So, yeah.
Yeah, I have to jump in on that. That's so important. First of all, you started to go towards the statistic. The United States has the worst record for morbidity for pregnant women, newborn,
And mortality.
mortality, the worst.
Absolutely.
And for African American women in the United States, it's double.
Absolutely.
The and the CDC data from 2022 is that, which is kind of hard to believe, 10 to 20% of new mothers experience postpartum depression. I, I and sort of grew from 10 to 20, so you actually wonder. But for Black and Latino mothers, it's 40%. So I know we're winding
And
down.
remember my statistics at the beginning, 1 in 5 women in the US will experience mental health
Right.
disorder during pregnancy or after birth. And for women of color, that is 1 in 3. So
Yeah.
that's very high.
So the question is, how does it show up specifically in mental health, and what should communities be aware of so that we can help stop that, help change those numbers?
And when you say how does it show up in
Well, in other words, in your studies,
Mhm.
what have you found that pushes that number up for minority women? Now, I hasten to say that I took some litigation training in law school, and you're never supposed to ask a witness that you don't know what their answer is. So it's like, duh, Dennis, don't you know? But go ahead. If you have to say it that way, fine. But what is it what one thing, if we could change, would help make a difference there?
Well, I would say stigma, just overall stigma, right? Just stigma of the condition itself.
Mhm.
And then structural racism, right? Because all in all, even for a highly educated, rich Black woman compared to a
Yeah.
lower income, maybe non-high school graduate, Black or white woman, our outcomes are still the same.
Mhm.
And that doesn't make sense, right? Because if you have higher education, studies show if you have higher education, which means you have better access to care, you have access to the best doctors, you can afford care, you have socially, you don't have issues with like social determinants of health, whether it's transportation, where you live, where you work, then why are the mortality and morbidity rates on the same level, right? So why should the risk of dying, no one should die, no one should be affected, but it's weird when someone like Serena Williams, who has all the money, who's famous,
Mhm.
and still
Mhm.
she becomes a statistic.
Yeah.
Right? So that tells you that's something beyond socio-demographics, your age or how much money you make or how educated or how popular you are. It's more than that. So I think it's a change, it's a system change of how we treat people. I do research in respectful maternity care, and this is something that women constantly, especially women of color, constantly experience. And this contributes highly to poor outcomes, right? So a lot of not being heard, right? Not being taken seriously. You mentioned earlier, a woman having a cesarean section complaining about pain. Some of you might have heard of, some antiquated things like, oh, Black people don't feel pain the way others do, right? And unfortunately, to this day, there's still providers that think that way, right? Or even just not, you know, not just in terms of tolerance of pain, but not listening to a woman and not believing her, right? So I always say, you know your body, right? You know your body, and you will know when something is wrong. And if a patient is complaining, hey, I feel like we've heard this story over and over and over again. We've heard stories in the recent news about women who go and they say they're in labor and they're turned away and they end up having their baby in the car or somewhere else. These things shouldn't be happening, right? So like I said, I think the first thing really is just stigma overall when it comes to mental health, especially for pregnant and postpartum women, normalizing that. And I think, listening to mothers and taking them seriously and not judging people based on where they're from, how they look, what their race is, class is. Yeah.
I
Thank
did
you.
I did have an opinion on that too. Because when I was pregnant, I was going through my undergrad for public health, and I did read that number, like the statistic about the US basically being the highest for infant maternal mortality in developed countries.
Mhm.
And it's also the most expensive, which is absolutely absurd to me. We get the least amount of time off. And in addition to that, I just feel like it's just like the whole entire system's kind of broken, right? Like you go for your workups for when you're pregnant and you start off going once a month and then it's once every 2 weeks and then eventually go once a week and you're stuck going to these routine appointments over and over again and then you get one postpartum appointment. That's it. And then they ask you at that appointment how you're doing, you tell them, and they're like, okay, like if there's any issues or, you're going through something, give us a call. But by the time I feel like any woman who is going through postpartum depression thinks to give them a call, it's far too late. They don't even want to talk to the people that are closest to them, much less call a doctor's office where they're going to be put on hold or transferred around and told, okay, well, we can get you in a few weeks. Like to me, I feel like the entire system's flawed. I really truly feel like that should be part of the package. You're paying all this money if you have insurance, even with good insurance. If you have to go to the hospital for anything, you're paying out of pocket no matter what, hundreds of dollars. It should be included that you have mental health workups for at least the first year. I think that would
Absolutely.
make such a big systemic change. And you know, my friend, one of my really good friends, she has, we're in Georgia, and she has Medicaid, and it
Mhm.
covers everything for her. You know, her husband also has some mediocre insurance. So everything that she has is paid for. Yet, why is there no access in Medicaid for any postpartum wellness? Like, that should be the standard to me.
Yeah, there really needs to be a change of the system. And again, sometimes it benefits you to have Medicaid because more things are covered versus private insurance, and sometimes it's the other way around. And then of course, depending on the state you live in, things can be in terms of Medicaid coverage that can be different. But I totally agree with you. And like I said earlier, it shouldn't be just this one postpartum visit and they might screen you and then that's it, because that's usually like your 6 week visit. But there's a whole year in which, you're at risk, right? So, there should be some like continuation, maybe at intervals, maybe every few months, right? Happening. And again, that's why it's important that, those close to you, family, friends, people in the community, they learn about what the signs are for, whether it's postpartum depression, anxiety, so that they can see this when it's happening, right? And be able to like, you know, push you to get help that you may need instead of relying on a doctor who you might not get to see after your 6 week visit.
Well, I did want to thank you, Dr. Reid. This was very helpful and helped us really achieve the goal that we had, which was to get information out there for the community. And I'll turn it over to Dr. Zahoor. Do you want to close us out? And before I do that, I want to thank all of the interns that have made this possible, um, some of whom are on this call, and Dr. Zahoor, and of course our intern coordinator, Sadia Barge. So thank you, all of you. And Dr. Zahoor, you want to close us out?
Yeah, sure. So thank you. Am I on mute?
No, we can hear
No.
you.
Oh, okay. Yeah. So thank you all for being part of today's public health town hall. Conversations like this remind us that improving community health is not just about medical care, but about education, access, and collective action. The issues we discussed today, uh, they were deeply connected to the well-being of families and future generations. At Jacksonville Urban League, our goal is to create spaces where knowledge is shared, voices are heard, and solutions are built together. We hope today's discussion not only informed you but also inspired you to take action, whether that means seeking care, supporting someone in your community, or advocating for better resources. We are grateful to Dr. Chinyere Reid for sharing her expertise and all of you for your time and engagement. Please stay connected with us for future events and initiatives. Together, we can continue working towards health equity and stronger and healthier community. Thank you.
Thank you.
Thanks, everyone. Thank you, Dr.
Have
Reid.
a good night.